Hi, my name's Siobhan Hickling. I'm the Public Health Postgraduate Coordinator. What is public health is a question we often get asked, and public health is a really exciting area of health to work in. It's working with improving, maintaining and bettering the health of populations, and that population can be at any level. It can be at a small group level, it could be at a community level, or it could be a national and international level. So it is a really exciting area to work in, and many of our public health graduates go on to really make a difference in the world. So why study public health at UWA? Well, UWA is in the top 75 in terms of the World University rankings for the Master of Public Health degree. We have academics teaching in very practical and collaborative units throughout the public health degree. And they're teaching in very active and collaborative ways because many of them are actively researching and working in the area at the same time as teaching with their students. Within the Master of Public Health, we have strong connections with industry, and we have an opportunity for students in a number of our units to work with industry, and we also offer a practicum where students can be placed within an agency working on a real public health project. So in terms of the programs that we offer in public health here at UWA, we have a graduate certificate in population health studies. For students that want to know more about public health, they can take a handful of units that are core to the Master of Public Health. Of course, if students then go on and decide to take their studies further, we can credit these across to the Master of Public Health program. Then within the Master of Public Health, we have two programs. We have a Master of Public Health that can be completed in 1.5 years, and we have a Master of Public Health with specialisation that is completed in 2 years. Both of these courses are really very similar and cover the core components that we expect from public health practitioners. This is with technical and practical skills in epidemiology and biostatistics, health promotion, health economics and qualitative research methods, as well as really studying the foundations of public health and what's currently happening nationally and internationally in the public health arena. Once you've completed all of the core units, students can elect to do a research dissertation on an area of interest with a research supervisor, one of our academics within the school. They may also elect to take a co-supervisor from another discipline or another school for their dissertation. Students may also like to do a practicum where they're placed in a public health workplace. It could be in a health organisation, a non-government organisation, or even the private sector. And they're supervised by someone on site as well as a university supervisor and really guided through a public health project that is helping populations. Some students may also like to complete their Master of Public Health completely by coursework, and those students that are electing to do this then have the option of taking a number of electives that we offer within public health, which could be further studies in health economics, it could be in food and nutrition, getting into the nitty-gritty of epidemiology and biostatistics. Other disciplines that we also have are occupational health and Aboriginal health. Really, there's many options, as you'll find once you come in to study public health, and many areas that you can take to really forge your own path and your own career in public health. So of the options that I mentioned in the public health program, there's a research dissertation, the workplace practicum, or completion of the Master of Public Health by coursework. Now, one of the key reasons you might elect to do a research dissertation is to really gain those research skills that are very useful and transferable if you'd like to go on to a research career, or working as a public health practitioner, you may need to research a particular area of health for a particular project that you're working on. The areas that you can do a research dissertation in are many and varied, and we do have a wide range of topics that our academics within the School of Population and Global Health currently supervise. Also, if you have a particular area of interest and you have a supervisor in mind, it may be possible to have co-supervision from somebody outside of the university. The workplace practicum offers key work integrated learning opportunities, And we can place students here, as I mentioned, in health organisations, non-government organisations here in WA. There can be rural placements with the WA Centre for Rural Health, and a number of our students have gone out to rural and remote areas for their workplace practicum. One of the key reasons to do a practicum is it's giving you this work integrated learning opportunity with the safety and the supervision of both an agency supervisor and a university supervisor, so that you're well prepared to work in the public health arena. And a number of our students have made great connections from their workplace practicums and have commenced their public health career from their practicum opportunity. So there's excellent employment prospects in Australia for public health graduates, and the median salary for a public health graduate within Australia is around $80,000. The areas that you could work in, or the job titles, could be project officer, health consultant, health economist. You could work in academia and continue research in either the university or a hospital environment. There really are many, many opportunities, and using the skills that you gain in the public health degree, you can take that to whatever area of health you'd like to work in. So the entry requirement and the entry process is the bachelor degree. However, if you don't meet that minimum standard for a bachelor degree, we do have the alternate entry option, which is a graduate certificate in population health studies. And this is offering a taste of a few population health units, and if you like these units, and if you feel that you're able to complete these units successfully, then this can lead on to an entry pathway for a Master of Public Health. So that's the key points of the Master of Public Health program from an academic perspective. Let's hear from one of our current students. So we're joined now by a current Master of Public Health student, Ravi. Ravi, can you tell us a little bit about yourself?
I'm originally from Singapore, and I migrated to Australia in the year 2000, and I've studied my Masters of Public Health at the University of Western Australia, and I'm due to complete my degree in July of this year.
And so why did you choose to study a Master of Public Health at UWA?
I chose to study the Masters of Public Health course because I wanted to pursue a career in public health which promotes healthy living in the WA community. And also the public health course encompasses a wide range of health topics which I'm very much interested in, such as health promotion, nutrition, Indigenous health, and chronic disease prevention.
Oh, that's fabulous. And what were the top 3 things that you enjoyed about studying at UWA?
What I really enjoyed about UWA was definitely the natural aspect of UWA. There's so many beautiful gardens, and Matilda Bay is just 2-3 minutes away from campus, and it's just a great place to just relax and connect to nature, and just a shift from the study environment.
It certainly makes the work and the study a lot easier, doesn't it?
Certainly.
Yeah.
Secondly, I definitely love the cafes at UWA. My favorite one's got to be the Catalyst Cafe, and they make great chai latte. And thirdly, the libraries at UWA. It's a great place to study. My favorite one's got to be, again, Barry J. Marshall. It's all built in with the latest state-of-the-art facilities to cater for student study needs.
Now, of the options within the Master of Public Health, we've got the dissertation, the practicum or coursework. Now, you chose the practicum aspect. Can you tell us a little bit about your workplace practicum?
I did my practicum placement at Rural Community Services based in Subiaco, and I worked on one project for about 6 to 8 weeks, and the project was based on how men could be role models in preventing female domestic violence. And as part of my practicum placement, I had the chance to interview the male staff at RUA, and got to get their insight on how men could be effective role models in preventing gender-based violence. So I really enjoyed that process, and I've definitely gained a wide range of valuable skills that would be beneficial to me in the future, such as project management skills, communication skills, interpersonal skills, problem solving, and I even had the chance to help out at a homeless shelter in Northbridge, and got to interact with the homeless people there too. So
that's fabulous.
It was a wonderful experience for sure.
And what advice would you give to other students that are looking to study at UWA and looking to commence a Master of Public Health degree?
Definitely, most importantly is to be super prepared and super organized for all your units. Literally, like a week or as soon as the unit outline gets released, just jotting down the assessment days in your diary or planner, and being very prepared and organized for every assessment and starting on it early, as will give you plenty of time to prepare and to score well in an assignment. And secondly, I would suggest to not be afraid to ask questions. The staff at UWA are great, wonderful tutors, and the admin staff, library staff, they're all amazing, and don't be afraid to ask questions. You're better to be safe than to be sorry. And lastly, work in groups, study in groups. If there's a particular a concept in lecture that you didn't quite understand, sitting down with a group of friends outside of your university contact hours and talking it through and unpacking the concept can really help.
That's great advice. It's such a great learning tool to work with groups. So thanks so much, Ravi. I'm really looking forward to your graduation.
Thank you, Siobhan. It's a pleasure.